Hello, everyone. This is Walter Proper, and I'm the Executive Director for the International Association of Public Health Logisticians. And we're continuing with our Chapter Leadership Spotlight Series. And today we're going to Tanzania, and we're interviewing Richard. And so, good afternoon, Richard. And I think let's start by giving us your full name and tell us where you currently live and where you actually come from.
All right. Good afternoon, Walter. Thanks for inviting me on this sport series. And my name is Richard Silumbe. I'm currently the manager of country chapter, IAPHL Tanzania Chapter. And I've been leading this since almost a decade now, almost, yeah.
And Richard, what do you do as your regular job?
Yeah, so
Yeah, go ahead. So what is your current your regular job that you do, and where do you come from actually, Richard?
Sure. I'm coming from Tanzania. I'm based in Tanzania, and I'm working on the Clinton Health Access Initiative, CHAI, as one of the international organizations, I think you know. And currently, I'm a leader program manager, managing different programs relating to malaria and fever in Tanzania. So we do support the NMCP, National Malaria Control Program, and in various ways. Yeah.
Great. And so tell us a little bit more about your overall experience with public health supply chain, how long you've been doing it, and what do you like about it?
Interesting area, and I've been working around the supply chain for a couple of years now. Apart from my academic credentials, the pharmaceutical management, which touch a lot about the supply chains on different procurement, selections, distribution, use. So I've been lucky to be part of these areas that directly impacted the supply chain. So I started working on the use block within the supply chain, and also I spent my years on the hospital based, and also then coming to the national programs, just increasing access of medicines and the private sector. And currently now I'm working on the health system strengthening related to supply chain as well, increasing access of medicine. So I'm happy on working on this area and having a different touch and different angles within the supply chain.
Yeah, it sounds like you've worked at different areas. It's great, including private sector. And so now, how long have you been with IAPHL, and how did you hear about it?
Yeah, indeed, this IAPHL, I've joined it or establishing a country chapter in 2013. When the first time when I attended the global health supply chain meeting in Addis Ababa, Ethiopia, and that's where our country was one of the many African countries didn't have the chapter. So I was I was given the role to work with others, including GSI, to establish this chapter in Tanzania. So since 2013, I've been engaged in IAPHL Tanzania.
Great. So the chapter's been there since 2013. How large is the chapter now?
Yeah, the years sounds good. Sounds more like, but the number of members are getting in and sometimes getting out. But we managed to reach almost 200 members of some time. But the active members, we are almost 76. And we are trying to keep on maintaining these numbers to ensure that we have a pool of all supply chain actors in Tanzania as well.
And what are the chapter members talking about now? What's the key issue for them in the recent year or so?
Yeah, according to the members, I think they have a lot of expectations on the IAPHL chapter. And one of the expectation, I think the way it was driven previously is like they can get a sponsorship of attending different international meetings, and that was like the entering point of for some of the members. But beyond that, people they're expecting to have a certain in-country discussions for what are the issues around the supply chain to increase the public health accessibility on the essential medicines. But basing on the context of the country's policies and how we can discuss, and then that can be another issue. But you can see people that are very interesting to discuss varieties of the challenges that are crossing the health supply chain.
Oh, great. And as all countries, they're all facing major challenges now. So what would you want people to know about the Tanzania chapter right now?
I think it is very interesting for other people, non-members or Africans or other people who are watching this, that Tanzania is one of the a great chapter that we are looking forward to have so many members so that we can work head to head with the government just to support them to ensure that all these gaps that we have identified, unexpected or expected, should be solved by discussions and also integrating the resolutions that are coming from this chapter and other partners as well. So I think we have started or we have continued to work on trying to ensure people are free to discuss things and trying to reach people in different platforms, basing on the user-friendly platforms, to ensure that all the resolutions or all the thoughts that these actors are providing, they can be heard by the government to make the better health supply chain system in Tanzania. So I think it's one of the chapter which is actively growing, and it has a lot of expectations when trying to make a special organogram to ensure that this is formal, and of recent we get secure the registration so that it can be here to stay as long as the health supply chain needs the experts to support it.
Excellent, excellent. No, I think it's fantastic. And I think, again, the role that IPHL can do in the local chapters to really help local governments to move forward and to bring that wide breadth of expertise like your chapter has in it is fantastic. So Richard, I want to thank you for joining us today and being our next chapter leader spotlight person. And we wish you all the best. And thank everyone. And we will continue our spotlight series. And so look forward for others from around the world. Thank you all. Bye. Bye, Richard.
Thanks, Walter.